It's a fact. African Americans have higher costs, hospitalizations, and deaths from COVID-19.
Come on, people, be smart. Avoid large crowds, wash your hands frequently, and mask up.
Going to crowded bars right now, it is dangerous for you and the people that you love the most.
Be patient. Those days will come back if we take extra caution for a few extra months. We've got this.
Keep the holidays safe for every generation of your family. Protect them and protect yourself. Mask up.
Hello, this is Michelle Van, and I am here to moderate tonight. We are welcoming you to our third COVID Facts Not Fear town hall discussion, sponsored by the Wichita African American Council of Elders and the Black Alliance. With regards to the coronavirus pandemic, here is where we are. Currently, with regards to the pandemic, nationwide, more than 18 million cases with over 320,000 deaths and counting. In the state of Kansas, we have over 208,000 cases and more than 2,448 deaths. Here in Sedgwick County in Wichita, we have more than 35,700 cases and 236 deaths. But we have worked hard in Wichita to do what we can to combat COVID and to keep our cases down and deaths down as much as possible. Collaboratively, the Council of Elders and the Black Alliance have embarked upon a comprehensive program that we are calling Facts Not Fear. And this outreach and education program is to assist and to instruct. Part of this campaign has been to encourage everyone in the Black community to wear a mask, watch their social distance, and wash their hands. Here is a television spot that was specifically created for our campaign.
It's a fact. African Americans have higher costs, hospitalizations, and deaths from COVID-19.
Come on, people, be smart. Avoid large crowds, wash your hands frequently, and mask up.
Going to crowded bars right now, it is dangerous for you and the people that you love the most.
Be patient. Those days will come back if we take extra caution for a few extra months. We've got this.
Keep the holidays safe for every generation of your family. Protect them and protect yourself. Mask up.
All right, how did y'all like that? That was awesome. I want to tell you that we are streaming, of course, on several different platforms. If you have questions, feel free to make sure that you ask those as we're going along. We would love to be able to, as we get into our discussion tonight, answer your questions, the particular questions that you have. In addition to this TV spot that you just saw, we're also producing other placeholders, and we've got some various places in which we are showing our podcast. We've got some great podcasts that are going. We've got some other social media that we're doing. And so we want to make sure that we are getting the message out. With regards to the pandemic, assistance in the community, we have been having some circles. And in those circles, we've got teens that are coming together because one of the things that they have said is that no one is talking to them. And so we've started having conversations with teens, asking them about COVID, asking them what do they understand. Middle and high school students are coming together. They're creating some media. They're creating some real pushes in their peer-to-peer groups to be able to really have conversation around COVID. We've also been involved in weekly food distributions. And so one of the things that we know that as COVID has hit, lots of people have lost their jobs. Lots of people have just been disenfranchised for various reasons, whether their job is still secure or not secure, but also because kids are now at home. And so because those kids are at home, where they would have been eating at school or elsewhere, now they're eating at home. And so we're trying to make sure that we have food. So we have weekly food distributions that are happening. We gave away huge boxes last Saturday. Earlier this month, we also gave out about 7,000 masks, which was an awesome thing to have in our community. We also have had two previous town hall discussions featuring COVID survivors, community leaders, healthcare professionals, all designed to address the pandemic and how we combat it and survive. Tonight's discussion, we are going to really be focused on addressing the terrible mental health issues. I don't know about you, but being isolated really got to me and has gotten to some other people that I know. And so we really want to talk about the the mental health, the emotional health, the psychological health, the stress that COVID has produced. Being at home, being isolated, being away from the norm has some real effects on people. And not to mention the fact that we have had some deaths. Even though the vaccine has come out and we know that it is available to some, it's not available to everybody yet. And so that's another thing that we want to kind of address a little bit tonight. The big question is, what do Black people do until the time when they are actually serviced? So tonight we have several distinguished panel discussion guests that are going to talk to us and going to have some really good spirited conversation. And so the first panelist that we want to have up tonight is Dr. Rita Stanley. Dr. Rita Stanley is an internal medicine specialist. She does alternative medicine, holistic health services, and she's in that Kansas City, Topeka area. So she's local. She's seeing exactly what is happening in our areas. And so we appreciate Dr. Stanley being on.
Listen, it's great to be with you. You are doing such a great work over in Wichita. I'm so happy to be associated with you. Just right down the road.
Yes, right down the street.
Yes, yes.
All right, our next panelist is Dr. Theopia Jackson. Dr. Jackson is the national president for the Association of Black Psychologists. She is also a professor. She is, we just had a conversation. She is finishing up her last couple of days of school this semester. And so we rah her because we know how hard it is to get to the end of the semester, making sure your grades are turned in on time. So welcome, Dr. Jackson.
It is a blessing to be here. Thank you for having me. On behalf of the Association of Black Psychologists, we want to honor the work that's being done in Wichita. Just to clarify, in addition to being that professor, I am the chair of the clinical psychology degree program at Saybrook University, which raises a whole nother level of responsibility and why I'm celebrating that this semester is done.
I feel you on that. And it is always a privilege to have women of color such distinguished faces. And so we could just have, girl talk, but we have Dr. Derek Novosek, and he's here too. So he's gonna keep us girls on track tonight. He is the assistant project scientist in the Department of Psychiatric and Biobehavioral Science, University of California in Los Angeles. And hopefully he's
Good evening. It's good to be with you all. Thank you for having me and for inviting me to be a part of this really important and timely discussion.
Awesome. All right. So our first question, Dr. Stanley.
Yes.
What has been your experience so far in what you're seeing with your patients in this Kansas City area, Topeka, because I know you kind of back and forth. What are you seeing as it pertains to mental stress and anxiety about COVID? I know that you're not seeing people in office. A lot of them are telemedicine, and I know that that's always an issue for some people. So what are you seeing happening?
Yeah, I can't say I'm seeing anything new. I'm just seeing more of it. An acceleration of symptoms that people may have had before the pandemic. But this pandemic, in my mind, I can see wrestling where the man's down on the floor in the mat and that guy comes down off the floor. So, I'm not seeing anything new, but there is certainly, I've never seen so much anxiety just at its worst, where people really feel like they're losing their mind. They feel like they don't have a lot of options or control of it, and just a loss of control. We like to feel like we are in control of our daily lives, but this pandemic has shown all of us that, one day you can be up, going to work in your office, doing your thing. The next day you are not. You are at home, you can't move, you can't do what you have lived and studied your life to do. So it really is making people have to reassess. But in the midst of it, their dis-ease is what I call it, is at a high pitch, very high, lots of anxiety.
Dr. Jackson, I see you shaking your head. Chime in on that. What are you seeing?
First of all, I'm appreciating what Dr. Rita is saying. I completely get that. I just want to clarify too, to expand it a little bit. that for me, COVID is not the only pandemic that's at play here. The racial pandemic is at play as well. So we're at the nexus of those two. And to be more specific, when COVID sat us down as a world, and particularly as a nation, then when the death of Brother Floyd occurred, the murder of Brother Floyd occurred, it was the murder that was felt around the world. So that has reactivated the continuous, persistent exposure to trauma that we've been contending with. So I echo what she's been saying. Some of this is familiar, but it's been taken to a whole nother heightened level around control and despair, because I'm seeing a lot of people in general are struggling with, where am I safe? It's not just the anxiety and the worry. Who do I trust? Are my babies going to be safe out in the world? So this is a very complex situation we're sitting in. And I have more to share later, but I just want to make sure I added that context in. I cannot talk about COVID-19 without talking about the racial pandemic, because they're intimately connected for us, as they should be for all of America. But we bear the psycho-spiritual brunt of it, because it hits a coreness. But at the same time, as we echo and underscore the things are at risk, our vulnerabilities, there's lots of strengths that we have that I believe that my colleagues and I will get into in your conversation later, that we want to remind us of and pull forward as we counter one more pandemic, because this is not the first one that we've been contending with for a very long time.
I would agree. And I would even say that we've been, even on top of that, we've got this health and mental health, and got that racial piece, and then we've got this whole economic.
Absolutely, all of it's the
Because
same.
as we've been shut down, there's a piece in which we've not been able to move, not been able to operate, not been able to do business as usual.
Yes.
Right.
I was getting my hair done tonight, prior to coming here, and my son made a observation. He said it is a hard time for barbers and beauticians. I said, explain what you're saying. He said, well, Mom, look, there's nobody. And the holiday is days.
That's right.
Right. And to your point, as I shared with my colleagues earlier, I'm now porting my COVID crown because of this, right? Letting all these grades come in. But you're right, because we're at the intersectionality of all of these places. There's a phrase that may feel familiar for many of us, that people said that if white America catches a cold, we catch pneumonia. Because before this set, we were already, quote, at risk in certain pockets. We're more likely to be disenfranchised economically. We're more likely to be disenfranchised in terms of the environmental safety of our communities and whatnot. And so once this hits, everybody's being hit by, but we have this other significant contributing factor of systemic oppression and systemic racism that brings all these complexities to bear. So I appreciate that.
Okay, Dr. Derek, you can see that you're going to have to jump in, right?
Yeah.
All right. So tell us, what are you seeing? What are you seeing? I mean, because we've got the East Coast, we've got the West Coast, and we've got the middle. So kind of tell us what you're seeing out there in California.
Yeah, well, unfortunately, this is really the worst part of the pandemic for those of us in Los Angeles. I think we're now being referred to as the new epicenter of the COVID-19 pandemic, in this third peak in cases. And so it's scary, and I think there's a lot of stress and anxiety in our community. And just as we've seen and discussed around the country, Black and brown parts of Los Angeles are being hit the hardest and bearing the brunt of this wave, with all of the reasons that Dr. Jackson alluded to. And so, yeah, we're just kind of hanging on here. We're in a stay-at-home order and hoping that it doesn't get too bad. I know our hospitals are starting to get stressed and overwhelmed.
So as we see that, personally, how have you been navigating that space? I mean, being locked down is a whole different thing than just please don't go anywhere. But a whole you're locked down is a different story. So how do you guys navigate?
Yeah, well, I think in California, we were, I believe, the first state to go in a stay-at-home order, and it was definitely, a shock to. It just felt like the world kind of flipped upside down within a day. And we've been in some sort of version of a stay-at-home order for most of the time since then. But this one definitely feels different, because it just feels like that things are a little bit more out of control. But I think for me personally, it's been really important to cope through connecting to friends and family, through exercise, and kind of getting out through prayer. Because obviously, we're in month 10, or I can't even keep track at this point. And it's taking a toll on all of us. And so I think it's really easy to get lost in that. And so it's really important that we kind of hang on to our coping strategies.
And Michelle, if I could expand upon that, 'cause I really appreciate what Dr. Novak is sharing. And my apologies, I should say Dr. Van. I keep getting comfortable with you, my sister. So
I'm
that's
Michelle.
the other place I'm moving in and out
I'm
of.
Michelle every day.
But I want to first give even more context. So the Association of Black Psychologists was founded in 1968, and it is independent of the American Psychological Association. It's the first ethnic psychological association to be born, and its mission is very clear. Its mission is to illuminate the African spirit, to elevate the African character, and to liberate the African mind. And so, as I hear what my brother Derek, if I may, is sharing, I would add to this is what we're trying to do is to restore this mess that we're in and remind our people of our own capacity to survive and thrive in spite of. So, for example, we shifted the language from being locked down and all that, because psychologically that has a negative connotation to it. But we're saying, how do we socially engage in a safe distance? And it's more than just a changing of words, it's a changing of direction. Also, when we think about mental health, our society usually identifies that as when something's wrong, how do I fix you? We're doing just the opposite, which is how do we remind you of your own healing capacity? When he talked about the engagement, so that's what we're saying. We've put out materials to help our communities reconnect with one another. How do you utilize this virtual space to command it the way we have everything else to work in our favor? This is a wonderful time for grandma in New York to do a tutorial session with her baby in Los Angeles while mom is having a cup of coffee. Right? So how do we tap into our geniusness, our creativity, and we're doing that, as you know, because we have not only beautiful meditation happening in this space, but our folks are commanding it from the use of dance and movement and playfulness. We've also created activities that Dr. Nobles has put out a piece for us. It's a sheltering in place workbook, so that families can kind of re-engage with one another. This is actually an opportunity to slow down, reconnect, get grounded again, feel one another as we deal with the stress of it. Now, as I say this, please be clear. I'm not trying to minimize the severity, because it's been hard. These are well-earned grades. Let's keep it real, okay? Well, so I too have had my worries, my fears, all of that. But then I also stand clearly in my faith in our African traditions, understanding that we are at our best when we are together. It's when we are trying to stay in an individual state of mind that we leave ourselves more vulnerable to be alone. But if we're in this together, I'm going to say, wait, when's the last time I talked to my sister friend? How do I have a kitchen table conversation through virtual? How do I reach out to people again? Because when we reach out to someone, we do not know the power of that call, that Zoom call, that text message, that something could be just what they need in that moment to get through to the next moment. So I would say message that. Go ahead, please. Go ahead.
I was going to say, I think the other part of that, and you spoke to it, was where I have really found a lot of comfort and in the midst of this is knowing that when people are empowered, with information, through this whole thing, starting way back in February or March, I knew there was a pandemic before this one, like you said, but this, from a health care standpoint was around vitamin D deficiency. That
Yes.
pandemic was way before COVID. So I said, okay, how can I help people at the beginning to understand that these are the things you have to do in order to have an immune system that's going to help you through this. So I spent a lot of time on that. So, it just helping people be empowered with things that they can do. How can I be protective? How can I do things that are going to protect me? Because frankly, even to this point, there's really nothing for early low symptomatic sort of COVID, but there are some things. So I find myself really energized by knowing that I can bring some things to the space to people. Here's what you can do. Doesn't cost a lot, just a matter of making a decision, taking these things, eating right, just helping people to be empowered. And we know how to do that as Black people. We know how to overcome limitations by figuring out ways to do things that work. So
Dr. Stanley, since you're on that, talking about vitamin D, and for me, it was very revolutionary to have conversation with you around what you are doing, what you are offering people. So let's kind of go into your slideshow. Go ahead and tell us kind of what are you offering and what are you kind of telling people, especially people of color, what they should be doing during this time, and how do we build our
Yeah, and do I need to do anything around? Okay.
Nope, your slides are good.
And these slides are not going to really, just go to the next one, please. Next slide. These slides I pretty much focused on, since we were talking about mental health. A lot of times I see people in my practice who come with primary mental health symptoms, but they don't realize that the stressors, those things that provoke their mental health symptoms, are causing a lot of physiologic changes in their body. So I spend a lot of time, because by the time people see me, it's usually a 911. They're anxious, they're depressed, they're tired. And so I like to show them in a very, I'm a visual learner. Show me what you're talking about. And I say to them, by the way, you are not crazy. Let me tell you what's happening in your body as a result of environmental stressors, nutritional stressors, physical stressors, psychological stressors, pandemic. This is what's going on. This is what your body's doing, because this is how God created our body. So when we're exposed to those stressors, there's actually an axis, we call it, from the brain to your adrenal glands. And adrenal glands sit on top of your kidneys, but they produce powerful hormones for a reason. It's a good thing. That's the way it's supposed to work. But I don't believe God ever intended for us to be in this constant phase of high stress day after day after day. So you have to understand that your adrenal glands do the best they can. They spit out that cortisol, they get your heart rate up, they get you out of danger, there's a lot of physiologic things going on in your body, and they should be, but at some point, just like a car, you drive it too long, you don't service it, something's got to give. Next slide. Yes, I'm just going to go through a few. If you can go to the next one. And this is just a picture of that axis. Starts in your hypothalamus, pituitary, and down to those adrenal glands to do what they're supposed to do, which is to get us prepared, get us out of harm's way, and get our body functions in a mode where they're going to protect you when it's not too much stress. Next slide. And I just wanted to show this just a minute because, again, we don't really think about adrenal hormones. We don't really think about cortisol, except negatively. Talk about belly fat, stress hormone. But understand that cortisol and DHEA, those are not the only hormones that come from the adrenal gland. But just look at all the different body functions that cortisol and DHEA manage. Every carbohydrate, that's your sugars, detoxing, your neural health, your memory, your sleep, your mood, your hormone system. I'm making a point. My point is, on a good day when things are working well and you've got your cortisol and DHEA, you have a body that's functioning optimally. When we're in a pandemic, or just the stresses of systemic racism, and are we going to be safe? Is my son going to come home tonight? You have to know that these hormones are attempting to do what they're supposed to do,
Mm-hmm.
but sometimes they get imbalanced. Next slide. Next slide. And these are the symptoms. So just recognize, I put this up here because you can just look at these symptoms and find yourself wired, tired, anxious. These are bodily, physical symptoms that you can feel and experience as a result of stress and the result of stress on your adrenal glands. And that's not the only gland that stress affects. But I just wanted to paint a picture for people so they don't think that they're losing their mind, they're sick, they've got cancer. Simply the stresses of life and the effect on your adrenal glands can create this whole constellation of symptoms that will drive you, or feel like they're driving you crazy, or certainly drive you into the doctor's office. And I've been on both sides of the fence. I'm internal medicine. I practiced primary care for 20 years. And then I found the beauty of functional medicine, which really looks at the body as a total system. In functional medicine, we don't pull out our organ systems. We look at the body as a total system. So we know that if there is stress, then that's going to affect you physically and spiritually. I mean, if you're a Christian, we're triune beings, right? We're spirit first with a soul in our body. So they all work together. And in functional medicine, we're looking for the root cause. What's the root cause of your symptoms? So we can deal with that and not just prescribe you a lot of medicines. I think there's just one more slide. This is just a test. This is a test I do all the time in my office, looking at your cortisol curve. And any of you all who remember your science, we just know that cortisol is imperative. And it shouldn't be low in the morning. It should be high in the morning, low in the evening, so you have normal get up with your energy. And then it's low in the evening so you can sleep. It's measurable, is my point with this slide. Next slide. And we know that there are some lifestyle, and I'm not saying this is easy, but I just want you to have hope. I want you to be empowered, that you have symptoms that can be affected with just some simple lifestyle changes, whether it's dietary, managing those carbs, getting adequate protein, making sure you're getting adequate salt if you don't have severe hypertension, although some people think more salt does help with hypertension. Reducing your caffeine, your alcohol, your sugar, your tobacco. And I'm not going to spend a whole lot of time on, I'm just saying to you, you can get better, and your better requires a team. My sister doctor is part of the team. I'm part of the team. My brother doctor is part of the team. So we're looking at you as a total person, total body, and my desire always is that people will say, at least now I know. I've got hope. And when I can tell people, here's what's going on in your body, here's why you're feeling this way, here's what you need to do, it just changes the whole attitude. It allows them to cope better. So I think that's it. That's what I wanted to get across.
And Dr. Stanley, if I may, too, because I very much appreciate this. So now the pediatric psychologist in me is coming out as well. I concur with you about the importance of arming our people with information. But even as you bring this in, I also would be inviting those who are being exposed to take this conversation home. How do you have the same conversation with the loved ones in your circle of life? How do we have it multi-generational? How it's not just driving how our children eat, but engaging our children in how they should be eating. Because it is our charge to deliver the information in bite size so they can own it as well too. So I just want to applaud you in doing that. I would also say it's very much in line with what we call our African-centered perspectives, because if we are doing right by our bodies, by our spirit, then this is our responsibility. And it is how we counter the madness that we're sitting in, because it's those messages that comes to us that makes us buy into poor health habits, because we're expected to be a certain way. And yet, again, I'll close. You're giving us the information we need to have critical conversation, kitchen table conversations, bite-sized real talk about how to take care of our spiritness, because we are spirit beings having a human experience.
That's exactly.
So thank you.
And I think, and we didn't necessarily talk about Dr. Does come from a spiritual perspective, making sure that as we talk about what we're doing, as we talk about that try, I think Dr. Novacek started to talk about that a little bit. The fact that as we begin to get all of the things that are going on with us, how do we tap into that spiritual? How do we tap into making sure that our mind, our body, and our spirit are intact? So talk to us a little bit about how you.
Was that for me? I'm sorry, it was cutting out just a bit.
Oh, sorry. Yes.
Yeah, that's first of all, I just want to say, as a stress researcher, I really appreciate that breakdown on the role of stress in the body and how it underlies both physical and mental health in that presentation in those slides. But for spirituality, I mean, obviously a barrier to, or a consequence of lockdowns and stay-at-home orders is that people don't have access to the physical church, and that's a huge, coping strategy and a huge source of support for many Black Americans and other people in this country. And so when you take that away, it's really important to think about other ways that you can connect spiritually, whether that's through attending services online, some sort of online gatherings with your church community, through prayer, devotionals, meditation and mindfulness practice. Even if you're not someone who is religious or spiritual, maybe connecting in terms of those types of practices might be helpful in centering yourself and combating that stress that was just shown to us how it has such negative consequences on our health. But it's also, in a lot of ways, we have control over it in terms of promoting wellness, even during such a difficult period, because we do have resilience kind of built in us. It's in our DNA.
And I think what I'm actually observing is an uptick of, particularly, again, now that our faith leaders have acclimated to this virtual space, they are reaching further and further. So we're actually being able to bring something to people they were limited by before geographically. So I'm actually seeing an uptick in recommitting to spiritual practices and belief. I'm seeing an uptick in wanting to be more curious about who are we as people of African ancestry? What's our true story? Wanting to read certain books, remind ourselves of our history and our greatness before we came to these shores as direct descendants of 1619. So I just want to, again, balance both here, and you'll hear me do this throughout our call. Yes, it's important to sort of name these challenges, but I think it's really important that we reclaim the narrative. And I'll say again, for me, we're not in lockdown. We are in social engagement and safe distancing. It's important because our people are already exposed to negative thinking. And when we say that, at least as a clinical psychologist, what comes up for me is that feeds into people's sense of hopelessness when they hear languaging like lockdown, lockout, those types of things. So we have to open them up to possibilities by naming this for them, that they do still have agency. They have some control. They have some decision. It's in a different setting now. So I just want to, again, my dear colleagues, I want to keep offering that. I underscore the risks, but I think to empower us, we must be very intentional to name that which we can do. And Dr. Stanley, again, just gave us beautiful examples. And then for the Association of Black Psychologists, what we've been doing is we've had a number of webinars, like many of us, but we started this very early in the game. We didn't need someone to tell us that this pandemic was going to hit our communities harder, so we were already getting ready. So we even had a webinar on how to grieve the transition of a loved one when their bodies were denied to us. This is not the first time that we've been in this situation. So all of these webinars have been recorded and they're on our YouTube page. That's again our gift to the world, to our communities, where they have a right to interrogate this knowledge and decide for themselves if this makes sense as they unlock what we mean by our African-centered wisdom that has been erased from our memory banks or
Mhm.
compromised. Even the science that Dr. Stanley just brought us, that's ours.
Mhm.
That's ours. This thing they call meditation, this is ours.
Mhm.
You know, when I think about what our mothers and fathers went through for 400 plus years on our behalf to be here today,
Yeah.
when they're out Dr. Michelle, you heard me say this before, when they're in the fields singing, they're not singing to entertain anyone. They're not singing to make their spirits feel good. They're singing to be in an altered state of mind to hold up each other's bodies.
Mhm. Mhm.
Because if you get into that flow of that song, you are in a collective meditative state. So I just want to continue to underscore that because we know a lot as, quote, Western scientists, but sometimes we don't know enough because our African wisdom gets shadowed, right?
Mhm.
And so to your point, we can't measure or quantify spirituality, but we know it when we see it.
Mhm. Mhm.
I would
And
agree.
we know it when we see it. So both sciences exist,
Mhm.
and so I just want to make sure we continue to do both. Let our families know, let our people know what the risks are, give them the science around that, but intentionally unlock their capacity to
Mhm.
heal and move through this. And that mental health services is not the answer. And sometimes it's the wrong answer because I would submit that there's a certain amount of knowledge that wasn't there that has inadvertently led to many people of African ancestry still being patients. But that's a whole nother lecture. The point I'm making here is that we have healers and wisdom happening in our communities all the time. Barbershop conversations, come on now. Come on
Mhm.
now.
Mhm.
Sister friends, our Greek letter organizations, when they're doing their good work, that is healing power work. So I think as professionals, we can further all of us by contributing to the science we have, but pushing through our people science.
Mhm.
So again, I want to wake up everybody, as
Mhm.
our youth would say, wake up everyone on this call who's listening to how
Mhm.
can I activate the goodness in me? How
Mhm.
can I tap back into the love for myself in the midst of all this madness and not fall victim to these negative messages that keep coming our way?
And
Let me, Dr. Stanley, let me let you, I'm gonna come to you. Let me remind everyone, if you are watching, please make sure that you ask your questions, make your comments. We want you to be doing that. We want to answer your questions because, I mean, we can talk all night because this is what we do. We get together and then we bounce off each other and we keep talking. But we want to make sure that we're answering your questions as well. So Dr. Stanley, go ahead.
no, just real quickly, to tie into what you were saying. I witnessed people over the summer months planting gardens more than
Mm,
I've ever seen it.
yes.
And I said, you know
Me.
what? And when I think about our ancestors, when I think about our grandparents, now they may not have had, they didn't have as much education, they didn't have as much, but they had to grow their food. And so they were well in a way that we aren't well now, because even though they didn't have a lot, what they had came from the ground, wasn't spoiled by all the different environmental things that we're. So, just knowing that we have the key to that, we just need to go back to some things. And it doesn't have people say, well, I don't have a backyard, I don't have a house. Get a pot, get an
Right.
old pan, just whatever you can do to have some control over your food. You may not raise animals, but at least you can do some things, and it's not hard. And I just refuse to take no for an answer. When they tell me no, there's a desert, there's a food desert. Well, okay, let's figure it out. How do
Right.
we, get the right food
And
here?
that's spiritual.
Mhm.
Let's talk about that. I mean, I think that that's a piece. You kind of touched on the fact that some of what we need to be doing is looking at what we're eating, and that is a real big push for you about food and what we're eating, how we're eating, as we look at mental health, physical Talk a little bit about that, because I think that food piece is very important.
It's really important when you think about it. And I know both of you all could probably speak to this more than me, just that whole relationship between Dr. Derek, between the gut, your gut health, and
Mhm.
your mental health. And we see that, we see it on Facebook, we see it in Google land, but we don't really, I don't know if people know how to connect that with their habits. So, food is extremely important in mental health, because if we're eating things that are microbiome, that whole nother, that's a so powerful. If we don't eat the right things and we don't have the right distribution, the right type of microbiome, then study after study after study has shown that it's going to be a potential effect on our mental health. And so we can, garbage in, garbage out.
Right.
We can't just eat anything, and we can learn. Don't tell me that we can't learn how to not purchase certain things or as much of certain things. I refuse that. Um, Everybody can learn. My people can learn.
Yeah.
And so, it's up to us to help, like you were saying, and however that happens. We just have to
Right.
teach people, and they accept it quickly. I'm amazed how
But
people, when you
right.
tell them the right things, right, you do right. Yes, there's hard
And
things.
I think part of that, as we have talked several times during the pandemic, and we've done some conversations, I think one of the reasons why, as Black Alliance came together, as Council of Elders came together, one of the things that we really wanted to do was try to make sure that we were providing good, healthy food, so that finances and food deserts and disparity were not an issue, so that you can come and get good vegetables, get good produce that you didn't necessarily have to pay for. And so that was really a part of our push in being able to have that food in there, is making sure that we're providing that. And I will admit that during that's
Now,
my place to hang out. Okay, there is a question. And
from about the homeless, which I'm happy
yeah,
to start, but I also want to, because it ties into what I was going to say here too. We have to remember the systemic oppression in which folks are sitting in, because you're right, our people will always make good decisions when the choices are made accessible to them. I'm going to use a very little example, and I'm going to, okay, so there's KFC. I'm going to take care of myself, but every now and then I got to, KFC reminds me of my childhood. Now, I lived in a very affluent area in California and worked quite a bit in Oakland in the Bay Area. And I always found it interesting. When I go to the KFC in Oakland, of course, I'm getting, my dirty greens, my rice and beans, but there's no fresh salad. I go to the KFC where I live,
Right.
zip code, because the zip code, I have nothing but fresh salad. I can't get my dirty greens. And truth be known, when I cook those greens in my house on Kwanzaa, everybody eats them, including people who are not of African ancestry. They love it. But my point here is, what I'm trying to say is that we have to also remember the social injustices so our folks can make the right decisions. What Wichita's been doing, bringing that food forward, is beautiful, because they're not leaving the veggies on the streets; they're eating them. So we have to be intentional in our collective power and hold our elected officials accountable to communities. And the same thing shows up when I worked again in pediatrics in Oakland, where they're looking at health disparities for our youth who are at risk of obesity. Well, again, where they're doing their fresh grocery shopping is in the dollar store.
right.
And the cost is so high, and it's vegetables that we would not touch in our particular neighborhoods. And so, but at the same time, KFC is promoting $10 to feed 20 people. So this is also tying into the question that's being asked about what's going on for those who are homeless and homeless teens. So first and foremost, these were already communities that were unseen and unserviced. So let's be very clear. This COVID is not making their life any better. Okay. So once again, we have to be very intentional as there is something healthy about not being distracted by my own depression in the midst of all of this, and instead to do for others. Like that's what's getting me through as the president right now of ABSI, because this is a hard time to be the president of any Black organization in the midst of all of this. But what wakes me up and serves me is when we can leverage our power for others. So to answer that question, we should be asking ourselves, how are our homeless people doing? How are our homeless teens doing? Who's supposed to know that answer? And what are you doing? You are accountable to us.
Yeah,
Dr. Derek, in LA, California, there's a huge homeless population. What's happening?
Yeah, I was just gonna speak to that. So, obviously in Los Angeles and California, everyone knows that we have a huge public health crisis with homelessness, and in some ways, COVID has caused our leaders to really prioritize serving them. And now, for the first time, we're seeing mass programs devoted and resources devoted to housing people in hotels, in trailers, in other buildings that the city and the state are occupying and using. And now the question is, what happens after the pandemic? What happens after COVID-19 is over? We can't send these people back to being unhoused. We need to make sure that there are some programs at the other end of this to house them. And also to house them in communities and places that are going to support them. One of my areas of research is community integration for people who've experienced homelessness. And if we really want people to be successful and to thrive in their communities, it's actually more than just housing. They have to have other services in place. But certainly nothing can be done without housing. And we have to make sure that our leaders, our government officials, our city officials really prioritize housing after this pandemic. Otherwise, we would have learned nothing from this.
Right.
So as you think about that, and you think about what immediately came to my mind was the whole idea of the hierarchy of basic. So as we look at those basic needs, shelter, having the ideal of safety, all of those things are so important. How do we begin to help people have those basic things? I mean, no, we can't solve the problem of homelessness, but what are some things that we can do to help people as they matriculate through the piece of needing safety, needing to have that security as they move forward?
Well, I'll jump in a little bit to get us started, but my colleagues, I'm sure, will have much more knowledge to share than I, particularly the work that you're doing, Brother Derek. But I do want to say that we have to hold each other accountable. I think that's the other part of it as well, too, that we have fallen into a state sometimes collectively of not seeing each other anymore. Because that's not directly affecting me, I too am not looking at it. I too am inadvertently contributing to the disenfranchisement, particularly when I think about some zip codes that we're used to being in as Black folks now. As soon as someone says affordable housing, then we get all twisted up as well, too. Or when there's different levels of socioeconomic Black folks showing up in one space, we want to somehow make sure I'm not that Black, right? That's not me. I'm the one that has a financial right to be here, not the one who's getting. See, that is our mess up. So we have to get through that so we can work more collectively, because these are our children. These are our families. These are our mothers. These are our fathers, our grandmothers. I also want to say, too, that I want to give a shout out here that the Congressional Black Caucus, under the work of Congresswoman Karen Bass, reached out to ABSI to do a deep dive into a quantitative research of really trying to understand how the COVID is impacting Black communities in diverse ways, including housing. And more specifically, this has been expanded to include all the ethnic psychological associations. So we're looking at it for communities of color. And it's also being supported and funded through the Urban League. So there is hope happening. There is, because again, this is going to be a huge database. It's for us and by us, right? And this will be some of we're looking for legislative and policy making to come out of this that's directly driven by our experiences, our needs. We're in the first phase now, which is organizing and beginning to tap into which database. But the second phase, as I understand it, because I'm not the one directly involved, but as the president, but the second phase will include on the ground folk. We're going to be having to partner with certain community organizations, which may even be some that's represented in this space now or on the listening area. We want to hear directly from them, hear the voices of our people about what their needs are, and create pathways forward that's driven by us.
Yeah. So as we think about that, so Dr. Jackson kind of brought out the idea that there are phases. So we're in a phase right now where we're bringing in the vaccine. Dr. Stanley, I know that you've been posting about the vaccine. Of course, I threw out the "Are you gonna get it?" because I'm not convinced yet. So tell us about the vaccine and what should we be expecting, and should we? I mean, in given the history that we've had with vaccines and trials and things of that nature, should we be concerned as Black?
Oh, sure. Oh, certainly. We can't. I mean, we're going to be. We have to acknowledge the past and that dark history. And, most of us know about Tuskegee and just lots of different things. There's a whole book on those sort of medical things. But, I believe that it's irresponsible for us to just discount it based on, we can't do that. To me, that takes the power from us. If we say, I'm not going to get that vaccine because of what happened to us in the past, I just don't believe it's not in our best interest. We know that Black people die almost 3.5 times more than whites. Hispanic, indigenous people, about 3.4 times as much die from COVID. When we get infected, it tends to be worse. And frankly, we're not going to get out of this. We are not going to get out of this place unless there are 70% or more people who are immunized. Right. Now, I'm not an anti-vaxxer, but you know me, I'm not a big, I haven't gotten a flu vaccine in 14 or 15 years. They're not very effective anyway. So I just keep my immune system as healthy as possible. But this is a different animal. This is not the influenza. This is SARS-CoV-2. It is deadly. It is not playing. And we can see that now. There's so much infection in the community. I tell people it's really hard to avoid it. You better be sticking close to home, because right now there's so much infection in the community. It's just challenging not to be in a space where there's one or more people who are infected. I did a video, it's on Facebook, just to go through the basics of the technology and just answer those questions that tend to kind of keep all these theories going, so people understand how the vaccine is made, how it works, that it's gone through the 3 trials and is still in phase 3, that FDA didn't just say, okay, give it all by themselves. They had an advisory committee that had to really do their own due diligence. So am I going to get it? Yes. Do I have concerns? Oh, sure. But I want to live. I've got a lot to do.
Amen. I agree with you on that.
But I agree
with you on that.
Yeah, I agree that it's much teaching, and people like ourselves on this platform right now, you're influencers, big time. So there are people that when you say something, they're going to listen. Okay, that's Dr. Stanley. Okay, all right. At least she's giving me the right information to make a prayerful, informed decision.
So, Dr. Stanley, I want to join with you.
I'm always going to seek your advice first.
Right. So, Dr. Stanley, I'm going to join with you with your ultimate objective in terms of us making informed decisions, but I also want to contribute 2 other points to that process.
Okay, I think we have to do them really quick.
I'll do them too. First and foremost, we need to honor our folks' concern and actually hear it and listen to it, because Sometimes
Yes.
what happens is we cut it off too soon to move them to the next stage, and it only perpetuates it. Number two, healthcare itself, the researchers must own it. They must claim that this is our problem, because right now we keep discussing it as if the problem belongs only to us to trust them. But they have to do something to trust us, because I want to underscore in the 1990s, there was a lead study in Baltimore which simulated Tuskegee. So this is not like this is something happened a
Right,
thousand years ago.
right.
Research is still not always in our favor. So I think both needs to happen, and
Mhm,
then they can hear the concrete science and make informed decisions.
mhm. I agree with you. We just don't have a lot of time, so we got to do it.
Oh, and then that coming to us for a while, so we got time.
Come on, Brother Derek, what were you going to say?
Yeah, I just want to echo the fact that we really have to listen to people's concerns. We have to validate them, because there is, reasons to distrust medicine, to distrust healthcare, to distrust research. And I think when people can really feel like they've been heard and their questions have been answered, they're going to be more likely to take the vaccine. If they're dismissed and kind of shut up right away, they're not going to be open to hearing what we have to say about the vaccine and its safety and the rigor of the science behind it. So it's really important. I just wanted to echo that point about making sure that people are heard fully, and address their concerns fully. And this needs to be, something that's a public health campaign that's on the
Yes,
ground,
yes,
that's led by our government, but it's also on the ground with our
Right.
community-based organizations and our
yes.
leaders
From
in the
people we
community.
trust.
We
We
have
have
to
a
earn their
responsibility.
trust.
Mhm.
Yeah.
And that leads us to our next thing, that on December the 28th, right around the corner, we will be having a whole conversation, another town hall, and it will be about the vaccine. We've got some people that have taken the vaccine, got some people that are going to be talking about the vaccine, how is it going to work. So we want you to make sure that you tune in to that on December 8th. We'll be right back to the same spot. So wherever you saw us tonight, we will be right back here on December 28th. Dr. Stanley, tell us where we can see, where we can hear you.
Where,
Where can they find you?
Rita Stanley, MD, Facebook is probably the easiest way to get to me. Rita
Okay,
Stanley,
Dr. Jack.
MD.
Follow
Rita
us
Stanley. Go
on
ahead.
Facebook, YouTube, and also Twitter, the Association of Black Psychologists.
All right, Dr. Novacek.
I think we still have 2 minutes, is what I'm seeing
Yep.
here. But you can follow me on Twitter at Derek _Novacek.
Okay, so we want to make sure that we are giving you information, because we want to make sure that you also understand that as you go out there on the Wichita Black Alliance page, you will be able to find this video. You will also be able to find information. We will have a handbook available to you so that you will have resources. Someone talked about meditation. Someone talked about, there are all kinds of things that we can do. We can be doing yoga. Right now in the winter in the Midwest, we can't necessarily garden outside, but we can bring in some things and do some gardening in our house with some lights and with water. And there's various ways in which you can garden inside. And so we want to offer you that it's not just a one way, one size fits all, but that there are a multiplicity of things. Right now, the Association of Black Psychologists, ABSI, doing so bono circles. They are other work as it pertains to making sure that we have resources in our neighborhood to take care of each other. One of the things we want to make sure that we're doing for us, by us, so that we are help your progress through this, so that we know that spiritually, naturally, physically, financially, we are progress. The advice and suggestions of all the panelists tonight will be available in that digital COVID book, and that manual will be in on www.wichitablackalliance.com, and it will also be on the Council of Elders Facebook page. Make sure that as we are coming to the end of our time, that you are staying safe. Have a blessed Christmas, Kwanzaa, Happy New Year.